But today I'm here to talk to you about our visibility technology, and I'd like to thank the OIS committee for having us present on this innovative technology. But let's think back. Let's think back to the year 1997. Average new house in 1997 was $124,000. The average salary was $37,000. Price of a gallon of gasoline was a little bit over $1. Unfortunately, the world lost a princess that year in 1997, and at the box office, Titanic was the big movie. But 21 years ago, we were getting ready to gather at the ASCRS in San Diego, and I was getting ready to launch the Array multifocal lens. So for the last 20 years, plus, I've been focusing on presbyopia. Whether it was a multifocal intraocular lens, it was an accommodating lens, it was the first corneal inlay, presbyopia has been my major focus. So I've been in your practices and I've heard your patients talk about the compromises that they're having to deal with to get their near vision. I've heard about glare and halos. I've heard about contrast sensitivity loss. I heard patients with the frustration of one eye set for distance and one eye set for near. I've heard about waxy vision and haze. That's where Refocus comes in today. Our mission is really to provide a highly differentiated, non-invasive surgical solution for the treatment of presbyopia. And our product, Visibility, is the first and only surgical solution outside of the visual axis for the restoration of near vision. We provide quality of vision at all distances without compromise. It really is an outside solution to that age-old problem of presbyopia. We're unique in that we're a bilateral solution. We provide a full range of quality vision. There's no sacrifice of light, so there's no sacrifice to image quality or to depth of focus. This is not a multifocal, it is not a monofocal manipulation to the visual system. We use a fully automated sclerotome that's guided by our docking station. It leads to really accurate and uniform tunnel creation that allows us to precisely place our visibility micro inserts. We place those inserts into the oblique quadrant just outside of the visual axis, so there's no refractive change whatsoever to a patient's distance vision and no change to the cornea. Let me share with you our procedure. So we've already placed the docking station, we've pulled back the conjunctiva, we've introduced the advanced sclerotome, and we're going to make a scleral tunnel that's 4 millimeters back from the limbus, 400 microns deep, and 4 millimeters long. Once that tunnel is created, we introduce the feeder tube. The feeder tube is thread through that tunnel, and it releases the first part of our insert system. We add the second part, and you actually hear an audible click to let you know that you are locked into place. We do that in all 4 quadrants, and then we reapproximate the conjunctiva. So how's our patients look post-operatively? This is a patient 1 month post-operatively. You can see on the image on the right that the eye is nice and quiet, and you cannot see these micro inserts under a normal gaze. So in December of last year, we submitted to the FDA our application for approval. We did 360 patients in the US clinical trial. We had a great group of investigators with a lot of clinical trial experience. I can't share with you that data for all 360 patients in the cohort, but what I can share with you is 20 patients that Dr. Frank Bucci and Dr. Ralph Chu did. They've presented on this information previously. So these are patients number 6 through 15 in their practice. And this first chart looks at the distance-corrected near visual acuity. And you can see that 100% of our patients are J3, 90% are J2, and 75% of those patients at 24 months are J1. So distance-corrected near vision is great, but really what's important to a patient is uncorrected near visual acuity. So what we call walking around vision. And when you look at those 20 patients and their UC NVA, 100% of those patients are either J2 or J3, and 90% of those patients were able to achieve J1 at 24 months. And the thing that you notice is the stability of that vision across that 24-month period. All the while without any impact to the patient's distance vision correction. So you can see there's very little change, if any, from the patient's baseline MRSE to their baseline or to their MRSE 24 months later. Important factor is what happens to this patient, and are they able to perform their near vision task much easier after the surgery? And you can see that 95% of patients said that it was significantly easier or better after the surgery. Only 5% said it was the same, and nobody said it was worse. So benefits of our visibility technology, we think we offer better patient outcomes. It's the only natural binocular solution that preserves stereopsis. It's not monovision, it's not bifocal, it's not a manipulation of a monofocal system. It's presbyopia reversal without sacrificing image quality, all the while offering a superior safety profile. We had a very low incidence of AEs in our trial. We had no SAEs, ocular SAEs. Our removal rate was less than 2%. And the key factor here is it's outside of the visual axis. So we don't deal with glare or halos. The natural crystalline lens and the cornea are unaffected. So we're excited about it. We submitted in December of last year. We're hoping for approval sometime at the end of 2018. And we're really looking forward to helping deliver the promise of uncompromised near vision in the very near future. Thanks again.